Hi, my name is Ressi. I'm an occupational therapist and certified lymphedema therapist. I'm going to show you how to perform manual lymphatic drainage, or MLD, on the leg for lymphedema or leg swelling. MLD is a light touch movement of the skin. It's not a deep tissue or deep muscle massage. We have clusters of lymph nodes in our neck, in our armpits, and in the groin. Those lymph nodes act as filter stations and are part of our immune system to help fight against infection. If you've had surgery for cancer along the pelvic region where they've removed lymph nodes, or if you've had radiation treatment, you may have developed swelling or lymphedema in the leg. Traditional MLD recommends that you redirect fluid from the leg to move up the side of the body toward the armpit. Those lymph nodes can then help drain fluid. Recent research has shown that the remaining lymph nodes in the groin area can in fact still help by draining fluid from the leg. If you've not had surgery for cancer or radiation treatment in the pelvic region, but experience swelling or lymphedema in the leg, you may redirect fluid toward the groin. We begin by doing diaphragmatic breathing exercises. When you breathe through the diaphragm, it's not a chest breath, so you're not going to do this movement. Instead, you're going to breathe through the diaphragm. When you inhale through your nose, your stomach will expand. When you exhale through the mouth, the stomach will relax in. Take a deep breath in through your nose. Exhale out through your mouth. Deep breath in. Exhale out. You're going to repeat that 5 to 10 repetitions. Next, you're going to open up the lymph nodes under the armpit. Place your hand in the armpit. Move the skin in a circular direction, 5 to 7 repetitions. Next, you're going to move the skin along the side of the body, moving in an upward direction toward the armpit. Place the flat surface of your hand along the body and start to move the skin in an upward direction, 5 to 7 repetitions. This is your circular pattern. You're going to move down the side of the body, but you're bringing the fluid up. So this is your pump technique where you pull the skin and let it go. You're creating a pathway along the side of the body, opening up the channels on this side, moving up toward the armpit. You can alternate with the circular pattern, followed by the pump technique where you stretch the skin. Next, you're going to open up the lymph nodes along the groin. Place the flat surface of your hands along the groin or the panty line. Move the skin in an upward direction, 5 to 7 repetitions. This is a circular pattern. I'm going to be working on this leg. I've opened up the channels on this side of the body. Now I'm going to open up channels across the body. you can move the skin across the body along the pelvic region. 5 to 7 repetitions of a circular pattern. So again, you have an option to move up the side of the body or across the side of the body. You now have pathways open along the groin, across the body, and also up the side of the body. As I mentioned earlier, traditional MLD redirects fluid along the side of the body toward the armpit. However, I'm going to focus on bringing fluid from the leg to the groin, as recent research has shown that any lymph nodes remaining in this region can in fact help drain fluid. If you think of a traffic jam, I'm not just going to start by pushing fluid from the foot. If you've got swelling in the ankle or the shin and the calf, you first need to clear the top part, clear the roadways at the top part of the leg so that the fluid or the traffic can flow along the leg. You're going to start at the top of the leg, place the flat surface of your hand on the thigh, and start to move the fluid in an upward direction toward the groin. You can do this circular pattern where I'm pulling the skin up toward the groin. You can also do the technique where you stretch the skin and let it go. So I'm not squeezing my leg. I'm pulling the skin and I'm letting it go. You want to clear the top part of your leg first. Move everything up toward the groin. You're going to do the inside of the thigh and bring everything up. Once you've cleared the thigh, you're going to move down toward the knee. Again, you're going to place the flat surface of your hand along the knee. Move the skin in a circular direction in an upward pattern. Five to 7 repetitions, followed by the pump. Proceed down to the shin and the calf, moving the skin in a circular direction upward toward the groin. So you'll notice that I alternate by doing circles followed by the pump. I'm not doing a long, steady stroke. I'm not milking it by doing this long stroke along the leg. I'm doing shorter movements to pump fluid out of the leg up toward the groin. Come underneath and pump. You're going to also move the skin along the ankle, followed by the pump. Include the top of the foot, and each of your toes. You want to be sure to cover the top and the bottom of the leg. If you have swelling along the hip, I do encourage you to bring it all the way up, out, and up. Start by clearing the top of the thigh, come underneath the thigh, proceed to the knee and behind the knee, the shin, and then the calf, the ankle, the top of the foot, and then the toes. You can perform MLD while you're seated or lying down. Take your time by moving the skin in an upward direction toward the armpit, toward the groin, or across the pelvic region to the other groin. If you found this video helpful, please subscribe, and thanks for watching.